Hi, I'm Renee Van Staveren. I work with hundreds of Medicare agents across the nation, and I lead Medicare education at Connie Health. In this beginner's video, we'll answer the question, what is Medicare Part D? I'll also review Medicare Part D's costs, coverage, and how to enroll. Let's jump right into it. What is Medicare Part D? Medicare Part D prescription drug plans cover most outpatient prescription medications for Medicare beneficiaries. Medicare Part D prescription drug plans are sold separately and are not part of Original Medicare. Prescription medication plans like Part D are offered by private insurance companies, but don't worry, they're also regulated by the Centers for Medicare and Medicaid Services, or CMS. How you get prescription drug coverage really depends on what other Medicare plans you're enrolled in. For example, if you are enrolled in Original Medicare Part A and B, you would be eligible to enroll in a Medicare Part D standalone prescription drug plan. When you're enrolled in Medicare Part A and B, you can also enroll in something called a Medicare Advantage plan or Medicare Part C plan. Medicare Part C plans provide equal coverage to Original Medicare, but with extra benefits, such as routine dental, vision, and hearing, and most often, prescription drug coverage. If you'd like to learn more about a Medicare Advantage, also known as Medicare Part C plan, I've linked that article in the description below. When you enroll in a Medicare Part C, also known as a Medicare Advantage plan, you'll likely bundle that with your prescription drug coverage. Now, when you bundle your prescription drug coverage with your Medicare Advantage plan, that is then called a Medicare Advantage prescription drug plan. Also, it's important to know that when you enroll in a Medicare Advantage plan, for most of the time, you're not able to purchase a standalone Part D prescription drug plan. It does need to be bundled with your Medicare Advantage plan. There are only a couple Medicare Advantage plans where you wouldn't receive bundled prescription drug coverage. And in those cases, you would purchase a standalone Part D prescription drug plan, but those are more the exception than the rule. Now, what does Medicare Part D cover? Every Medicare Part D or Medicare Advantage prescription drug plan varies. Each plan's formulary is different. However, there are certain types of medications that must be covered. As a general rule, the Centers for Medicare and Medicaid Services, or CMS, requires that there are 2 medications in each category for prescription medications that Medicare beneficiaries generally need. Also, Medicare Part D and prescription drug plans typically cover most vaccinations unless they're already covered by Original Medicare Part B. I truly hope that you're finding this video to be valuable. If you are, take a moment and hit the like button below and watch this video till the end, where I'll share more helpful links to support you on your Medicare journey. Now, let's get back to the video. Now, I'd like to talk a little bit about what a prescription drug plan formulary is. These can be really helpful in terms of selecting the right plan for you. Every prescription drug plan, either with Part D or a Medicare Advantage prescription drug plan, has a formulary. A formulary is simply a list of medications that prescription drug plan will cover. This is really important because every single prescription drug plan is different. You must check the formulary before enrolling, or you could end up discovering that your prescription isn't covered. But what if you're already enrolled and you suddenly need a medication? In those cases, you can request an exemption, pay out of pocket, or file an appeal. Most importantly, though, if you have an existing prescription medication that you need to take, make sure that you're investigating whether or not it's on that plan formulary. Also, plan formularies aren't static. They're always changing. This is why you should never enroll in a prescription drug plan and set it and forget it. Your Part D and Medicare Advantage prescription drug plan should be reviewed annually. The last thing you want to do is try and fill your prescription just to find out it's not covered and you have to pay out of pocket. The best time to review your prescription drug plan is during the annual enrollment period, and we'll talk about that shortly. Now that you know about prescription drug plan formularies, which let you know whether or not your drug is covered, let's talk about prescription drug plan tiers, which will tell you how much it will cost. Within a prescription drug plan's formulary, there are tiers, and each tier will kind of tell you how much a prescription will cost you. For example, a prescription medication in a lower tier will generally cost you less than a medication in a higher tier. As you consider your medication tier, don't shy away from generic medications because they can really save you money. According to the Food and Drug Administration, generic medications are copies of brand name medications. Because generic medications use the same active ingredients as brand name medications, you should definitely consider them for cost savings. So now that we've covered prescription drug plan formularies and tiers, I have one more tip for you, and this is about pharmacy selection. There are preferred and standard pharmacies, and knowing which pharmacies are preferred will save you money. So as you're reviewing your prescription drug plan options, consider the formulary to ensure that you're covered for the prescriptions you need. Consider generic medications for cost savings and try to get a preferred pharmacy to fill your prescriptions. Doing these 3 things will help you save money overall. Now that we have a general framework of how formularies and tiers and pharmacies work, let's discuss exactly how much Medicare Part D or a Medicare Advantage prescription drug plan may cost you. The cost of a Medicare Part D plan can include the premium, an annual deductible, coinsurance, and copayment. The costs depend on the plan that you choose and the medications that you take. First, let's talk about the premium. Most Medicare Part D plans charge a monthly fee called a premium, although some have a $0 a monthly premium. The premium varies on the plan that you choose and can change annually. This is why it's so essential to review your Part D or your Medicare Advantage prescription drug plan annually. Not only can your drug coverage change, but costs can change as well. Medicare Part D plans set their premium max with the Centers for Medicare and Medicaid Services, and this happens annually. Your plan premium cost will depend on the plan that you choose. Now let's talk about how your costs may differ between a standalone Part D prescription drug plan and a Medicare Advantage prescription drug plan. When you enroll in a Part D standalone prescription drug plan, along with original Medicare Part A and B, you'll have a premium threshold that is set by the Centers for Medicare and Medicaid Services. And there is generally an average amount nationally, kind of a base premium cost. If you're interested in knowing what that amount is, I've linked an article in the description below. Now let's discuss the cost if you decide to bundle your prescription drug plan with your Medicare Advantage plan. This would then be called a Medicare Advantage prescription drug plan. If you enroll in a Medicare Advantage plan that also includes prescription drug coverage, your prescription drug plan premium will be included in your Medicare Advantage prescription drug plan premium. Now let's talk about something that may catch you a little bit off guard. It's called the Medicare Part D IRMAA. You might be familiar with this because Part B also has an IRMAA, but let's jump into it. If you happen to be a high income earner, you may also need to pay a higher premium because of the Medicare Part D IRMAA. IRMAA, which stands for Income Related Monthly Adjustment Amount, is an additional amount that you would pay on top of your monthly premium. This extra amount is based on your modified adjusted gross income from your taxes 2 years prior. The Centers for Medicare and Medicaid Services, CMS, goes ahead and sets the thresholds for IRMAA on an annual basis. So these change. To learn more about Part D IRMAA and whether or not you fit within those CMS thresholds, I have linked an article in the description below. There is some good news about the Medicare Part D IRMAA. That's because you can appeal it. You can file a Part D IRMAA appeal based on life-changing events. If you'd like to file a Part D IRMAA, call and speak to your local licensed Connie Health agent and they can help. Now let's move on and talk about the deductible and coinsurance for prescription drug plans. Most prescription drug plans have a deductible. This is the amount that you must pay out of pocket for your prescriptions before your insurance plan begins either covering those drugs or cost sharing. While deductibles vary from plan to plan, CMS does set a maximum threshold for an annual deductible. The annual deductible amount changes annually. Now, if you're curious what the highest possible Medicare Part D deductible is this year, there's an article linked in the description below. With a deductible, plans offer varying options. In fact, some plans have a $0 deductible, while other plans cover select medications before the deductible. If you're interested in a Part D plan with a $0 deductible, when you call and speak to a local licensed Connie Health agent, let them know. And if you're curious if your medication will be covered before the deductible, ask your agent. Now let's talk about coinsurance. If you have an annual deductible and you've paid it, your plan will then start cost sharing. The Medicare Part D copayment or coinsurance is the amount that you pay for a prescription medication while the plan pays for the remaining Medicare approved amount. If your plan has a copayment or coinsurance, this amount can change. Your plan could also start offering a generic form of your medication. But if you remain on the brand name medication, you could end up paying a lot more. As a review, to reduce your coinsurance costs, request a generic version of your medication and learn which pharmacies in your area are preferred. When you get a prescription refill, ask whether your plan covers a generic version. Switching from brand name to generic could save you a lot of money. Most Part D plans have a coverage gap. You may have heard this referred to as the donut hole. You enter the coverage gap once you and your plan have spent a certain amount of money on your deductible, coinsurance, and copayments. CMS sets the threshold for the coverage gap on an annual basis. Once you're in the coverage gap, you'll pay no more than 25% of the cost of your plan's covered prescription drugs. And some plans may offer lower costs when you're in the coverage gap. To learn more about the coverage gap or the donut hole, click the article link in the description below. Now, once you're in the coverage gap, there's another threshold that you can meet, and that's catastrophic coverage. Once you hit that threshold, which is set annually by CMS, you won't pay anything else for a prescription drug medication for the remainder of the plan year. To learn about what the catastrophic drug coverage threshold is for this year, click the link in the description below. Now, this is important. For those enrolled in Medicare Part D, beginning in 2025, your maximum out-of-pocket costs for prescription medications will be capped at $2,000. That's a big difference from how it's being done today. And those enrolled in Medicare and Part D Extra Help will not enter the coverage gap. Let's talk about Medicare Part D Extra Help. The Medicare Part D Extra Help can help individuals with limited income and resources afford their Part D plan costs. Those who qualify for Part D Extra Help will not have a coverage gap, and they won't pay a Part D late enrollment penalty. They will also receive assistance with the cost of premiums and deductibles. If you're interested in learning more about Part D Extra Help and determining whether or not you meet the income and resource requirements, click the article link in the description below. Now let's talk about the best time to enroll in a Part D or a Medicare Advantage prescription drug plan. If you're enrolling in a Part D prescription drug plan or a Medicare Advantage plan for the first time, the best time to do that is during your initial enrollment period. Your initial enrollment period lasts 7 months. It includes the 3 months prior to your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday, 7 months. Now, the other time to enroll for the first time is during a special enrollment period. Instances of a special enrollment period might include when you retire or you lose employer drug coverage or you move. There are many reasons why you might be eligible for a special enrollment period. It's important to know that a special enrollment period is a limited time and usually lasts about 60 days. For example, a 60-day special enrollment period might begin the month after your employment ends or the month after losing credible prescription drug coverage from your employer. It's whichever happens first. Here's some warning about the Part D late enrollment penalty. If you choose to delay your Medicare Part D prescription drug coverage, you must have credible prescription drug coverage from you or your spouse's employer, union, or another source that provides equivalent coverage to Medicare's standard drug coverage. If you don't, you could face a late enrollment penalty when you do go to sign up for prescription drug coverage. Suppose you enroll in a Medicare Part D or a Medicare Advantage prescription drug plan outside of your initial enrollment period or a special enrollment period. In those cases, you may face a Part D late enrollment penalty. In either case, your Part D late enrollment penalty will increase your Part D monthly premium. This Part D late enrollment penalty will increase your monthly premium for as long as you have Medicare prescription drug coverage, unless you're enrolled in Medicare Part D Extra Help. Now, when's the best time to make a plan change or to review your Part D or your Medicare Advantage prescription drug plan? That would be during your annual enrollment period. The Medicare annual enrollment period, also sometimes called the Medicare open enrollment period, runs from October 15th to December 7th annually. This is the prime time to review your Part D or your Medicare Advantage prescription drug plan to make sure you're still getting coverage for your prescription medications and at a cost that you can afford. During the annual enrollment period, you can join, unenroll, or switch Medicare Part D or Medicare Advantage prescription drug plans. Make sure you mark the annual enrollment period on your calendar. That is October 15th to December 7th annually. But bonus for people who are enrolled in Medicare Advantage, you can then review your plan options again during the Medicare Advantage open enrollment period from January 1st to March 31st. Now, how do you find the best Part D standalone prescription drug plan or Medicare Advantage prescription drug plan and enroll? A local licensed Connie Health agent can help you compare the coverage and costs of Part D standalone plans and Medicare Advantage prescription drug plans in your area. When reviewing plans, your Connie Health agent will check the formulary to ensure your prescriptions are covered. We can also help you estimate prescription drug spending. To compare and enroll in a Part D or a Medicare Advantage prescription drug plan, call to speak to your local licensed Connie Health agent. Connie Health wrote an article about Part D's coverage, costs, and how to enroll. To read about Medicare Part D, visit the link in the description below. In this video, we answered the question, what is Medicare Part D? And we reviewed Medicare Part D's coverage, costs, and how to enroll. If you like this video, hit the like button. And if you want more videos like this, subscribe to our channel. For more Medicare for Beginners videos, click the video links in the description below. Until next time.